Trial tappers find hope, resilience, and post-traumatic growth after life's trials and traumas. Today, I want to explain a little bit about how people might do that. When I teach the theory of post-traumatic growth, I often use this theory or image of the maple tree and how that symbolically can help us find post-traumatic growth. So again, in that theme, I want to explain to you a little bit about more about this today. I had this image drawn up to explain when the farmers want to take and make this little tap that goes into the tree. They have to take a piece of metal and round it and hollow it and put it into the tree. So this is a picture of a individual taking a hammer to beat that metal down into something else. When we look at the theory of post-traumatic growth in that view, I often say, what are they making? So they're making taps. So these are some images of different forms of taps. They're hollowed out that go into the tree. When we talk about the theory of post-traumatic growth and how do you get there? Well, generally from therapy. And I always recommend that you go to therapy. And as a therapist for 24 years, it's very important to seek out help from someone as you're trying to get there. When I look at my own story and the trauma that I went through, as I explained in previous videos, I realized after a few months I was struggling with some things, right? And so I needed some help. And what did those look like? You might be trying to decide, do you need to get some help? And when you might need to help is when you're having a lot of sleep problems, right? A lot of chronic irritability or anger, maybe some hopelessness, problems at work or at home, or these reactions are getting worse for you. Maybe you're having some relationship problems, maybe having some thoughts of harm of yourself to others. Now, I know in my experience, I was struggling and having difficulties in many of these areas. Now, I wasn't thinking of harming myself, but I was struggling with a lot of these areas for a while. So, even as a therapist, I was struggling with this. So I decided after a few months, it's time. I need to get some real therapy for myself. And that's what I chose to do. And what did I choose to do? Well, I could do a lot of different things, but I decided to go find someone that was experiencing EMDR therapy. EMDR therapy is eye movement desensitization and reprocessing. It's an interesting theory. I really love this theory. Many people are finding this helpful, whether they're veterans or first responders, but just general public. It's become very popular. There are many therapists that are experienced and skilled in this. So in EMDR therapy, I did all these different approaches. Sometimes people think it might be a little strange, but basically they're doing a variety of techniques along with the talk therapy, right? So one of them is to, move their finger or pencil in front of you and you track that with your eyes as you're talking. Some will put a headset on you where you hear some beeps alternating as you're talking. Another approach is to have these they're called tappers or little vibrating devices in your hands that kind of alternate back and forth a vibration in your hand, doing this while you're talking through the experiences. For me, I found that very beneficial. Um, when I realized the individual in my trauma as a child also lives in the same state with me and I could interact with them again, I realized I needed to go through that EMDR therapy and kind of process through what could happen is if I interacted with the individual again. I really encourage you to consider it as one of the approaches. Now, it's not the only approach out there, right? There's a variety of techniques. There's another one kind of like EMDR therapy. It's called art therapy, talk therapy, cognitive behavioral therapy, exposure therapy. There's many others for you to consider. Some people find it's helpful to do other self-help things like yoga, meditation, breathing exercises, visual imagery. Obviously, exercise is always encouraged. Support groups. These things help many people. Qualities that are desirable for post-traumatic growth would be support groups, maybe how you cope religiously with things, maybe some positive reframing, reflecting on as coping, maybe openness to new experiences, gratitude, and obviously we talk about hope. Like I said, there are many different approaches to help you find post traumatic growth. And it's not a quick fix. It can take some time, take a lot of effort, but you can do it. I hope that you seek those people that can help you. Don't get discouraged. Don't give up. If the first therapist you encounter you don't like or you don't connect with, keep going. Look for another therapist. It may take a couple of different therapists or different approaches to help you with this in your journey. I encourage you to keep working at it. Eventually, you can find this growth in your life. If any of this had value for you, please share below what was helpful for you. If this is helpful for others, please share with others. I hope to see you in the next video. Thanks for watching.